Wanjiru, you brought up the issue of health care delivery. He did speak about that again as well today in the evening, and he spoke about having increased the healthcare facilities to 1,912 to be exact, a 43% increment, 30 million Kenyans connected to water, 400% growth with NHIF. Isn't this enough?
Well, like I said, the trajectory in terms of service delivery, especially in health and water, has been benefited, paradoxically, from the COVID pandemic, because with the pandemic came a sense of urgency, that money needed to be committed and needed to be directed towards these services. And you saw all kinds of action taking place around water and around agricultural systems and also around health. Now, by 2017, of course, there's been growth. But, you know, you're talking about a GDP moving from 4 to 13 trillion. So what's the commensurate access to health service that would be there? NHIF, of course, in terms of health, we've seen the role that NHIF has played in terms of creating access. So yes, that's a good opening up NHIF to more, to more users has been a benefit. But even the implementation of the National Health Insurance system has not been well managed. And you saw part of it is a governance issue, but then the other part of it is just inconsistencies in terms of policy, whereby you've had, you saw kind of a downgrading of access. Yeah. Some of the issues are, maybe you could say, are issues that would need to be sorted out, but in health in particular, and one of the styles of this government has been very project-oriented implementation, as opposed to policy that is well discussed, that brings the stakeholders. So by 2017, the increments in health were there, but they were marginal. And a lot of those increments were due to devolution. And devolution was being fought by the national government, inadequate resources. So some of the gains have been despite, the presidency. Yeah. They were because there is a constitution and the resources have had to go down, and you've got 47 governors, some of whom have done very, very well. So yes, there are gains, but are they in tandem with this GDP growth? Are they in tandem with the so-called investments? If you look at health, we've signed, a regional protocol, the Maputo Protocol, that we should be spending 15% of our budget on health. Yeah. Because health is really important in that the amounts that Kenyans pay on health services are impoverishing households. Households are not able to save between what we spend on food and what we spend on health services, and then to some extent also transportation and education. Yeah. It means that Kenyans live hand to mouth. Okay. We are unable to save, so that the economy is unable to grow. So the question to ask really is, has the government of Uhuru Kenyatta done enough to enable Kenyans to enjoy health services without going out of pocket? And so, yes, there's been some marginal benefits, but not because of their policy. Yeah. President Kenyatta was uncomfortable with health, was uncomfortable with agriculture, to the extent that he was uncomfortable with devolution. He didn't see the vision. Trickle-down economics has not worked. Yeah. The expenditure on large infrastructure has eaten into the overall budget. So you've seen allocations made to the health sector, and then midway, those allocations are reduced and redirected to debt repayment, to large infrastructure. So no, I think on economy, any successes that are there maybe have happened despite the policy of Uhuru Kenyatta, which was unfortunately captured around large infrastructure.